Ancient Filipinos in the pre-Spanish era, before 1565, regarded their health as a harmonious relationship with the natural and the supernatural. The indigenous people had a wide range of knowledge in medicinal botany. The seeds of igasud from the mountain regions of Visayas was used as an antidote for poison. The Spaniards thought it would benefit the people to teach them the Western ways of medicine and health. The Babaylands were replaced by the Spanish friars during this period, establishing and administering not only political and social control, but also the first health institutions in the country. Hospital Real, funded by King Philip II, was the very first hospital in the Philippines. It was initially built in Cebu in 1565 and was relocated to Manila. In 1863, an earthquake demolished the hospital, among other buildings in Manila. Another hospital, Hospital de Naturales, was concomitant with the first Franciscan mission in the Philippines between 1577 and 1578. In this mission, a lay brother and botanist, Juan Clemente, raised funds and built two simple wards of nipa and bamboo to accommodate numerous beggars that flocked the gates of the convent. The Hospital de Naturales was relocated and was renamed in honor of the patron saint of lepers, Saint Lazarus. During the Spanish era, there were lots of epidemics in the Philippines. In 1574, a smallpox or bolotong was the first recorded epidemic in the history of the country that killed over 30,000 Filipinos by the 1760s. In response to this, the Spanish colonies, including the Philippines, was introduced a smallpox vaccine. After declaring independence from Spain on June 13, 1898, General Emilio Aguinaldo established a revolutionary government, one that included the Bureau of Public Health. But after only 2 weeks, the US took over and established a military government led by General Wesley Merritt. A Board of Health for the city of Manila was constituted through General Order No. 15 on September 29, 1898. On August 1899, campaign against smallpox continued, and the first form of civil registry in the country was established. In 1907, the Leper Law Act No. 1711 provided for the compulsory apprehension, detention, and segregation of lepers at the Cuyuan leper colony. Under the Democratic candidate Woodrow Wilson, the Jones Law, which was crafted to formalize U.S. commitment towards granting Philippine independence, was passed in 1916. The Jones Law created the Philippine Senate, which authorized the reorganization of the executive orders of the government under Act No. 222. Four departments were created, among them the Department of Public Health Instruction. The statistics of the Philippine Health Service showed a steady increase in preventable diseases like typhoid, malaria, beriberi, and tuberculosis. This resulted in the deaths of more than 50,000 people. In 1932, Theodore Roosevelt Jr. abolished the Philippine Health Service, the Office of the Public Welfare Commissioner, and the Tuberculosis Commission, and combined these agencies under the Bureau of Health and Public Welfare through Act No. 4007. On May 31, 1939, the Department of Health and Public Welfare was created by virtue of Commonwealth Act 430. Dr. Josefa Bella became the first Secretary of Health and Public Welfare. Under President Quezon's leadership, the government built and improved hospitals. Training on maternal and child health services were made more comprehensive, and nurse supervisors were made to take public health nursing courses. However, on December 6, 1941, the Japanese bombed Pearl Harbor in Hawaii. The Philippines found themselves at war with the Japanese. Under the Japanese occupation, incidents of tuberculosis, malaria, and severe malnutrition increased among the lower classes. Over 5,000 previously segregated lepers escaped in search of food. But the Japanese occupation was relatively brief, lasting from 1942 to 1945. While the country was being rebuilt from the war, President Manuel Rojas saw the need for restructuring within. His term saw the separation of the country's health and public welfare offices through Executive Order No. 94, issued on October 4, 1947. The split gave birth to the Department of Health, headed by Secretary Antonio Villarama. Towards the end of the 1950s, the goal of bringing healthcare closer to the people was adopted by the administration of President Carlos P. Garcia through the creation of regional health services via Executive Order 288, signed on February 20, 1958. Dr. Clemente Gatmaitan formally became the Secretary of Health in 1974. During his term, the restructured healthcare delivery system was initiated, classifying health services into primary, secondary, and tertiary levels. In February 14, 1995, the National Health Insurance Act of 1995 was passed. Priority was given to the most vulnerable sector of the society, the underprivileged, sick, elderly, disabled, women, and children. The Philippine Health Insurance Corporation, or PhilHealth, was established to oversee its implementation. In 2011, the Sin Tax Reform Bill, which had been pending in the Philippine Congress since 1997, was passed as Republic Act 10351. This law significantly increases the taxes levied on cigarettes and alcohol, from which additional revenue will be financing the enrollment of 5.6 million Filipinos to PhilHealth. Health Secretary Enrique T. Ona considers the passage of the Sin Tax Reform Law, or RA 10351, a victory for the health of the Filipino people.